Many people search online for foods that lower blood pressure. But which of these actually work, and which are simply internet myths? Current hypertension guidelines don't recommend relying on a single superfood. Instead, the strongest evidence supports an overall healthy eating pattern, particularly the DASH diet, together with reducing sodium intake. In this video, I'll explain 5 dietary changes backed by scientific evidence, how much they may lower blood pressure, and who is most likely to benefit. Number 1. The DASH diet. If there is one diet that has consistently been shown to lower blood pressure, it is the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. Rather than focusing on one specific food, it is an overall eating pattern designed to provide nutrients that support healthy blood vessels while naturally reducing foods high in sodium and saturated fat. The DASH diet encourages plenty of vegetables, fresh fruit, whole grains, beans and lentils, unsalted nuts and seeds, low-fat dairy products. At the same time, it recommends limiting processed meats, sugary drinks, foods high in saturated fat, highly processed foods. One of the reasons the DASH diet works is that it naturally provides more potassium, magnesium, calcium, and fiber, while reducing foods that tend to contain excessive sodium. The original DASH clinical trial demonstrated that following this eating pattern lowered blood pressure even without significant weight loss. Clinical trials have shown that the DASH diet can lower systolic blood pressure by approximately 5 to 6 millimeters of mercury. Practical tip: simple place to start is aiming to fill half your plate with vegetables or salad at lunch and dinner. So if the DASH diet is considered the best overall eating pattern, what is the single dietary change that has one of the biggest impacts on blood pressure? Number 2. Reduce sodium. Reducing sodium intake has some of the strongest scientific evidence of any dietary intervention for lowering blood pressure. Current guidelines generally recommend limiting sodium to less than 2,000 milligrams per day. That's equivalent to about 5 grams of table salt, or roughly 1 level teaspoon spread across everything you eat in an entire day. Many people assume most of their salt comes from the salt shaker. In reality, around 70% of the sodium in many Western diets comes from processed and packaged foods. For example, one packet of instant noodles may contain around 1,800 milligrams of sodium. That's almost your entire recommended daily sodium limit in a single meal. Common sources include processed meats, takeaway meals, fast food, packaged snacks, canned soups, many breads, sauces, and condiments. Large clinical studies have shown that reducing sodium intake can lower systolic blood pressure by approximately 5 to 6 millimeters of mercury in people with hypertension. Combining sodium reduction with the DASH diet produces even greater benefits. Practical tip: when shopping, compare nutrition labels and choose lower sodium products whenever possible. Number 3. Reducing sodium is only one side of the equation. The other important mineral is potassium. Eat more potassium-rich foods, as it helps the kidneys remove excess sodium from the body and supports the normal relaxation of blood vessels. Foods naturally rich in potassium include bananas, potatoes, sweet potatoes, tomatoes, spinach, avocados, beans, lentils, oranges. Rather than focusing on one particular fruit, the goal is to include a variety of potassium-rich foods as part of an overall healthy diet. Increasing potassium from food has been shown in clinical studies to lower systolic blood pressure by approximately 3 to 5 millimeters of mercury. Important reminder: foods high in potassium is not suitable for everyone. People with chronic kidney disease or those taking certain medications may need to limit potassium intake. If you have kidney disease or have been advised to restrict potassium, speak with your healthcare professional before making significant dietary changes. Number 4. Beetroot has received considerable scientific attention because it naturally contains dietary nitrates. These nitrates are converted in the body into nitric oxide, a substance that helps blood vessels relax and widen. Several clinical studies have found that beetroot juice or beetroot-rich diets can produce modest reductions in blood pressure, particularly in people with hypertension. Meta-analyses suggest that dietary nitrate from beetroot may lower systolic blood pressure by approximately 3 to 5 millimeters of mercury. While this is a modest effect, it may contribute to overall blood pressure control when combined with other healthy lifestyle measures. Practical tip: fresh roasted beetroot or beetroot added to salads is generally a better choice than heavily processed varieties that may contain added sodium. Number 5. Another food that has attracted significant scientific interest is garlic. It has been used in cooking and traditional medicine for centuries. Researchers have also investigated whether garlic supplements may help lower blood pressure. Several systematic reviews suggest that certain garlic preparations, particularly aged garlic extract, may produce modest reductions in blood pressure in some people with hypertension. The proposed mechanisms include improving blood vessel function and increasing nitric oxide production. However, studies vary considerably in the type of garlic preparation used and the doses studied. Current hypertension guidelines do not recommend garlic as a primary treatment for high blood pressure. Several meta-analyses suggest that aged garlic preparations may reduce systolic blood pressure by approximately 5 to 8 millimeters of mercury in people with hypertension. Garlic should therefore be viewed as a complement to an overall healthy lifestyle, rather than a replacement for proven lifestyle measures or prescribed medication. Practical tip: using fresh garlic in cooking is an easy way to include it as part of a heart-healthy eating pattern. A key takeaway is that someone who follows the DASH diet, reduces sodium, maintains a healthy weight, exercises regularly, and limits alcohol may achieve a much greater reduction than any single change alone. Some people will still require blood pressure medication, particularly if their blood pressure is very high, or if they have comorbidities or other medical conditions such as diabetes, chronic kidney disease, or established cardiovascular disease. Thank you for watching Medical Explained. If you found this video helpful, consider subscribing to Medical Explained for more evidence-based health information.